to COVID-19 reopening seminar. It is part 2 of the seminar that we conducted on Tuesday on the impact of COVID on the global economy. And today we try to discuss questions and issues surrounding reopening, especially the trade-off and the challenge of how you balance between public health concerns and the economy. And of course, behind it, the politics around that as well. So this event, again, is a collaborative effort among many regional centers at Harvard, the Data Center for Russian and Eurasian Studies, the Fairbanks Center for Chinese Studies, the Rockefeller Center for Latin American Studies, the Lashmir Mittal and Family South Asia Institute, and finally, the Harvard-China Health Partnership at the Chan School of Public Health. I am Winnie Yip. I'm a professor of global health and global health policy and economics at the Chan School of Public Health, and also the faculty director of the China Health Partnership. Today, we're very delighted to have an esteemed panel with expert knowledge of 4 countries that in recent months have been wrestling with this question of how to reopen. Our first panelist will be Joe Allen. Joe is a colleague at the School of Public Health. Before he joined the School of Public Health, he was a forensic health investigator of sick building, and I'll let him explain what that is about. And he also now directs the Healthy Building program at the school. Our second speaker will be Professor Karl Lauterbach. He is a professor of health economics and clinical epidemiology at the University of Cologne. And more significantly, he's a member of the parliament, and he can really share with us firsthand experience of his advice to the chancellor of what to do, what not to do. Our third speaker is Professor Judy Twig, who is professor of political science at Virginia Commonwealth University. And I'm sure many of you who have followed the COVID development in Russia have seen a number of her writings. And she is also the senior associate with the Russia and Eurasia program of the Center for Strategic and International Studies. And last but not least is Professor Huang Yashen, that many of you know, whom doesn't need any introduction. Professor Huang is the EPO Foundation Professor of International Management and also the Faculty Director of Action Learning at MIT Sloan School of Management. Between 2013 and 2017, he also served as the Associate Dean in charge of Sloan School's Global Partnership Program. He also started the China Lab and the India Lab at Sloan School, focusing on providing advice on for a number of small and medium entrepreneurs in India and in China. So without further ado, I'm going to introduce each panelist to give a few minutes of remark. Then we will have a moderated discussion among them and then open to questions. For all the viewers joining through YouTube, please feel free to submit your questions through YouTube, and the question will be sent to us, and I will try to organize them and have them presented to our panelists. So, Joe.
Well, thank you, Winnie, and hi, everyone. I'm really glad to participate in this panel, and I'm looking forward to the conversation that we're all going to have. So for my remarks, I'll really focus on the U.S. context, and in particular, my area of expertise and background, which is how to keep people safe in buildings. So Winnie mentioned my background as a forensic investigator of sick buildings. So I'll give you a quick introduction to what I've done in the past, because it really helps understand where I'm coming from in terms of how to put in controls such that we can get back to work, back to school in a safe way, and really keep people safe while keeping the economy functioning. And the context, of course, in the US is quite different, where we haven't gotten a handle on this, really. So we're reopening the economy at a time where we don't have our cases under control. But so let me just give you the quick background here. I direct the Healthy Buildings program at Harvard School of Public Health. My expertise is in exposure and risk science, really the field of trying to keep workers healthy. I'm a certified industrial hygienist. This is the field that anticipates, recognizes, assesses, and controls hazards in the workplace. Prior to joining Harvard, I spent many years as a consultant in private practice doing these forensic investigations of sick buildings. And I still do this on the side. And sick buildings, these were cases where we had an infectious disease outbreak in a hospital. Many times someone had died in one of these buildings. Everyone's at risk. It's a low information environment, huge financial stakes. I've done breast cancer clusters in buildings, investigated these. I've investigated brain cancers related to buildings. I worked on a project for the US military where they had 11 infant deaths on a military base, and they were concerned it was the housing that was causing the problem. So I mention these because it's while the pandemic is really unfamiliar to all of us, there are elements that are really quite familiar to me in terms of what's at stake here, how we put in controls to keep people safe in our buildings, and then how do you communicate that to a weary public? So one of the first things I've done, and I've been writing frequently on this, starting in early February, as I saw this happening in Asia, and I wanted to get the message out, I wrote in Financial Times that healthy buildings should be the first line of defense in our control strategy. Thinking about the steps you should take in your building, like increasing the ventilation rate, putting in better filtration to protect people indoors, recognizing early on that all three modes of transmission were happening. I could talk about that more as we get into the panel. I also have written about not just the building, but how do you place the building in a larger framework of risk reduction? And here I use what we call the hierarchy of controls. Control strategies as 5 parts that we've used in our field of worker health and safety for decades. Eliminate the hazard. So how do you stay home or prioritize work from home strategies? Substitution, identifying the core people that have to go back to work first. Engineering controls. These are healthy building strategies. Number 4 is administrative controls. De-densification strategies, maintaining physical distancing. And last, number 5 is PPE for personal protective equipment like mask wearing. And if we put these controls in place, it's a hierarchy, and I named them from most effective to least effective. And now all we've done in this writing, and I wrote an article in Harvard Business Review 2 weeks ago that outlines this hierarchy of controls. The next question we should be asking and people should be asking is, well, I put in these controls, how will I know it's working? And here, this is currently where we're at in the US as we reopen and have started to reopen quite aggressively. And hopefully organizations have their controls in place, but how will you know it's working? One, you have to take into account these regional indicators of disease spread, lagging indicators like hospitalizations and cases, but also the indicators within your organization, what we call taking the pulse of the building. I had a book published last month called Healthy Buildings, How Indoor Spaces Drive Performance and Productivity. And we talk about the need to take the pulse of the building. Much like you do when you go to the doctor's office, the first thing they do is they take your pulse, check your blood pressure, take your temperature. These are indicators of human physiological performance. We need to be doing the same thing for our buildings. And the last thing I'll say is this approach is that while we're dealing with the recovery phase and the response phase, we have to keep our eye on that next phase, which is resiliency. As we move into the next phase of this pandemic, have our eye towards a potential second wave, and think about post-COVID-19. For the first time in history, everyone in the world is acutely aware of the importance of the built environment and buildings on our health. Expectations are changing. Right now, people are expecting things in their buildings related to COVID-19. They will then start to ask these other questions. What else are companies, universities, governments doing to protect and promote my health beyond infectious disease? So thanks for having me, and I'm looking forward to the conversation with the panelists.
Carl?
Hello. Am I on? I could not hear you.
Yes,
it's not
you're
me?
good now. I
Okay.
unmuted myself.
Okay, you unmute. Well, first of all, thank you so much, Winnie, for making this possible. This is wonderful, and I'm very pleased to join this important group. Just briefly, in terms of, let's say, what I'm currently doing, I'm currently, as you mentioned, a member of parliament. I'm the speaker for the Social Democrats for Consumer Affairs and also health expert of the party. And I've been in that position for a long period of time. And so this is, let's say, what I currently do. In terms of my daily activities, I'm part of the parliamentary group of Social Democrats, the ruling coalition. We have a middle center coalition of the Conservatives and Social Democrats. So middle left, center left, that is us, the Social Democrats. Center right is the Christian Democrats. That's the current ruling coalition, as the Chancellor. So I'm part of the parliament, and in Germany, all laws are made by parliament. We are a parliamentary democracy, so I'm involved in the laws I will be talking about a little bit in a moment. Number two, as an epidemiologist, particularly interested here in COVID-19, obviously at the moment, and it touches all of the colleagues in the field, and with my institute at the University of Cologne, I advise my colleagues in parliament and also in the government as to what the studies show in terms of, let's say, possible vaccines, possible lockdown measures, possible, let's say, contact tracing apps and so forth. So everything from modeling studies to, let's say, medical studies, I try to translate for my colleagues into parliament so that we can assess the evidence. And I'm part of a large team of about 25 scientists who do that. And that has been an ongoing endeavor for me for the last couple of months. And number three, I frequently explain our decisions to the public in newspapers, on TV, or in the radio. I have been on TV almost every second day for the last couple of weeks, because we have made it our, let's say, policy to explain what we are doing as lawmakers to the public as we go along, including all uncertainties, and also including, let's say, scientists that advise us so they can come with us to the screen and explain where we currently are, what we know, what we don't know. So we have tried to opt for complete transparency in the management of the disease as of now, and I'm part of that transparency campaign, which I think is, let's say, a good way to go about this, but we will see how well it works in the long run. Where does the pandemic stand in Germany as of now? Well, medically speaking, we were lucky. We were hit somewhat later than Spain or Italy, or in particular China. So we were able to respond at a time quickly, when we already knew how devastating the disease would otherwise be. Then we also mounted a fairly rigorous and also fairly consistent lockdown approach. So we immediately closed large meetings. We closed all businesses, and we closed the schools, and came up with a major support package which would allow everyone basically to stay home. So no one had to come to work for financial reasons. People who are employed or self-employed people were provided, roughly speaking, about 60 to 70% of their net income from, let's say, a package that was provided by the government. Big companies were supported by lending, let's say, opportunities, low risk, government supported and government guaranteed lending opportunities, and small businesses were supported directly, and everyone in the workplace was supported by, let's say, unemployment or low employment, underemployment benefits. So these underemployment benefits made it possible that people would stay in their jobs but stay at home. And unemployment only rose by about 20%. So we have an unemployment rate now of about 6%, up from 4.5%. So it has been, by and large, a limited economic catastrophe on the labor market, because unemployment is still at 6% at a level which is, let's say, manageable. And the recessions that we expect will be between 6.5 and 8.5% for the running year. That depends to some degree what happens internationally. We are very much like China, export oriented. And if the worst case comes along, then we will have a recession of 8.5%. If we do well, we have a recession of about 6.5%. We have just now passed a major economic stimulus package to combat the corona crisis. So once we opened the economy again, and when we eased the lockdown, starting about 4 weeks ago, we developed a package of about 130 billion euros. This is roughly speaking 150 billion US dollars, a stimulus package which I can briefly explain. I will not go into details, but it is basically a 57 measures package. It does include a reduction of the value-added tax from 19 to 16%. It lowers electricity costs. It makes, let's say, ecologically produced electricity cheaper. It does have a relief package for municipalities, because all the municipalities lost income because the taxes went down. So therefore, we, from the federal level, support the municipalities. We provide a children bonus of 300 euro per child. We have a multi-billion, 25 billion aid for companies package, which in particular supports hotels, restaurants, clubs, bars, and so forth, or travel agencies. So those parts of the economy that were most heavily hit, we came up with incentives for buying electric cars, because we want to combine the stimulus package with a shift towards a more green economy. So we do not want a standard stimulus package. We decided there would be a particular shift in the stimulus towards a more ecological green economy. And part of this, for example, is making, as I already mentioned, electricity cheaper. Another part is that we give incentives to buy electric cars. For each electric car that you buy, you will get a 6,000 euro, let's say, support by the government. That is not given for cars that are standard combustion. We came up with a stimulus package for hospitals, because many hospitals actually lost money. They had more COVID cases, but all other cases were much fewer. So we will put 3 billion into our hospitals, and we will also support public testing, SARS testing, SARS-CoV-2 testing for everyone, even no symptoms included, so that we, let's say, improve on our testing regime. We are currently able to do about 1 million tests per week, but we want to gear that up to a couple of million tests per week. And in order to make that possible, we created a package which allows, which, let's say, puts the sickness funds, the public sickness funds, under an obligation to pay for testing, even if there is no symptoms or no risk factors, so that we get a better control of the disease. We also invested 5 billion into railways in order to have more railway transport in comparison to car transport, in order to, let's say, support the ecology. We invested into a big research package for digitalization, communication, artificial intelligence, climate research, and energy, let's say, development research. A total of a 16 billion package for research, and ultimately we invest about 9 billion additionally in hydrogen research, because we want to support the industry in coming up with a hydrogen economy, so to make the economy independent from fossil energy. To make a long story short, we came up with a stimulus package after easing the lockdown in steps by 4 weeks. The stimulus package supports workers and, let's say, small businesses directly. It does have a large research and development part, and it supports the economy, but the economy is supported in a targeted way, and the target here is to make Germany a more climate-friendly, export-oriented research and, let's say, development country, and also to provide our economy a stimulus to move towards, let's say, ecological power, green economy, to go away from our fossil fuels-based economy as we had it. That's where we currently stand.
Great, thank you very much. So let me invite Professor Twig to talk about the situation in Russia.
Well, I'm a political scientist. I work mostly in the policy world, and so I'll be talking quite a bit about the political drivers and implications of what's happened in Russia. The main takeaway of my brief introduction here will be that, as in the United States, as in all other countries, Russia is facing huge challenges in finding the right balance between the needs of the economy and the need to control further spread of the virus. Right now, the pace of reopening of the Russian economy and Russian society is being set according to political imperatives. They are not following public health best practice. They are not defining key benchmarks for the virus and then waiting for those benchmarks to be met. Everything is being driven by politics, and that's what I'll explain here. First, I'll give a brief overview of the state of the epidemic in Russia. Russia has the third highest burden currently of reported cases in the world after the United States and Brazil. There are about 500,000 total reported cases in Russia. And there have been many headlines coming out of Russia about COVID-19, defective ventilators causing fatal fires in Moscow and St. Petersburg, questions about the accuracy of the reported coronavirus case data, especially the quite low death rates in Russia compared to many other countries. Doctors have been quite vocal in complaining about shortages of personal protective equipment, about not being paid their promised bonuses for working with COVID-19 patients. So there's been no shortage of news coming out of Russia about COVID-19. Broadly, the reported cases in Russia peaked in the first week of May. There were about 10 to 11,000 new cases a day back then. Since then, there's been a slight decline and a stabilization. They're at a plateau of about 8,500 new cases each day. They've been at that plateau consistently for about the last 3 weeks. Most importantly, the epidemic in Russia began in the capital city. It began in Moscow and was centered there until quite recently. A month ago, at the peak of the epidemic, about half of the reported cases were in Moscow and the surrounding Moscow region. Now, only about 15 to 20% of the reported cases are in Moscow. The other cases are in cities and in less urban areas around the country, across the 11 time zones of Russia. This is important because Moscow is much better equipped. Its hospital infrastructure, its medical personnel are much more able to deal with the epidemic. The hotspots vary across the rest of the country. The sources of transmission have been in care homes, in oil and natural gas facilities, in churches, in hostels where migrant workers live, certainly in hospitals and other healthcare facilities, at weddings and funerals. Testing is widespread. Testing is of much better quality than it was 2 months ago, but there is definitely significant community spread in areas outside Moscow. In other words, the increases that we're seeing outside Moscow are not just artifacts of additional testing. The public health response to Russia's pandemic has been set mostly at the regional level, not centrally in the Kremlin or in Moscow. And this is where we get into the politics. The core of the strategy for Russian President Vladimir Putin has been to be able to blame others if things go badly, especially the regional governors around the country, and of course to take credit for himself if things go well. So the severity of the lockdowns and the restrictions around the country have varied. They've been set at the local level. Most of those lockdowns have been strict, and that has caused significant economic hardship. About 1 in 10 Russians report having lost their jobs since the epidemic began. Now, Russia has a $160 billion rainy day fund, but it's not been willing to spend much of that, which is interesting because it's hard to imagine a day much rainier than this one. Government support has been mostly for large state-owned or state-connected enterprises. There's been really scant support for regular people, for small businesses. So the economy has been hurting and people are anxious to get back to work. And so now the country is beginning to reopen. That's happening in different phases, different paces around the country. But there's one big ticket item that is driving the calendar of reopening everywhere. And that is an upcoming vote on amendments to Russia's national constitution. So if you've read about this, you know that it's all about Putin's presidency. This new set of constitutional amendments create strict term limits to the office of the president, so that now there will be no more than 2 consecutive 6-year terms allowed for the Russian presidency. But the key element here is that this amendment also zeroes out Putin's terms. So even though he's been in office on and off since the year 2000, what this means is that in the year 2024, when his current term ends, he'll be able to reset his clock. He'll be willing to run for 2 more consecutive terms under these new rules if these new constitutional amendments are approved, which means he could conceivably be in power until the year 2036. So this is obviously a monumental vote for Putin politically. It had originally been scheduled for April 22nd. Now it's been postponed until July 1st. And Putin wants to get this done as soon as possible because his public approval ratings have been shrinking. That strategy that I mentioned earlier of his pushing authority and responsibility for setting the rules of the response to COVID-19, that strategy has backfired. Many of the regional governors have risen in the polls and are now more popular than Putin. Putin is increasingly now perceived as relatively weak, as out of touch. He is losing that masculine, in-control image that he has crafted so carefully over the last couple of decades. I mean, people are making jokes about Putin now in a way that they never have before. So he has an imperative here to get this constitutional vote done before his political position slides too much further. So there's huge pressure on regional leaders to make sure that their COVID-19 lockdown rules ease in time for this vote to take place. The biggest reversal has been in the city of Moscow itself. The mayor of Moscow, Sergei Sobyanin, has been a very visible, forceful leader throughout the crisis. Think of Andrew Cuomo in New York. That's the analog. So Sobyanin put in place very tough restrictions. People couldn't leave their apartments without a digital pass. There's even been, in the last couple of weeks, a weekly schedule on which apartment blocks are allowed to go outside for walks on which days of the week to prevent everybody from going out at the same time. It's been quite a strict and intrusive regime. And as recently as last weekend, on May 27th and 28th, Sobyanin was saying that this regime in Moscow would be in place for quite some time longer, that in fact there would be some restrictions potentially until there is a vaccine. But then on June 1st, Putin announced that this vote on the constitutional amendments would happen on July 1st. And a couple of days later, it's reported that Putin and Sobyanin had a one-on-one conversation about what was happening. And then all of a sudden it was announced just this past Monday on June 8th that the restrictions in Moscow would be lifted the very next day, with the final stage in lifting restrictions in Moscow happening the last week in June. Voila, just in time for this vote to take place on July 1st. So it's clear that politics and not public health is driving the decision-making in Russia. The regime is pulling out all the stops to increase voter turnout for this referendum, to ensure that the vote delivers the answer that they want and to make it look like many people support that right answer. So regional election officials are being encouraged to hold farmers markets, children's book fairs, other events at polling stations to lure people into the vote. In the region of Krasnoyarsk, they're even sponsoring raffles on election day, giving away prizes like apartments, cars, cell phones. Other regions are considering other types of incentives like that to show up. So politically, they're packaging all kinds of goodies into showing up for this vote. Again, trying to ensure that Putin has the capacity to stay in office for an extra 12 years when his term is up in 2024. Now, from a public health perspective, they are promising temperature checks for every voter. People are being required to wear masks. But given the increasing number of people testing positive for coronavirus in the regions, it seems premature from a public health perspective to be moving forward with having this in-person vote on July 1st. COVID-19 is not yet sufficiently under control in most parts of the country for this vote to be taking place. But again, clearly there are many factors beyond just public health driving these decisions. I'll stop right there.
Great, thank you so much for a very insightful, in-depth looking into the inside of the decision-making in Russia. Thank you. Yashin?
Thank you, Winnie. There's a lot of discussion about how China initially responded to COVID-19, the information, the lack of transparency, and now it has become a big political issue between China and the United States, between China and EU. I'll be happy to come back to that if there's interest. I've written about this, and it's very clear that China's initial response was problematic, and the delayed response was the reason why they had to go to such an extreme measure to close down the city, to close down the entire province. That said, since today's topic is about economy and reopening, so I'll focus on that particular issue. And I think there are several lessons and experiences from what China has done. And then I don't know much about Russia and Germany, but I know a fair bit about the United States. So to the extent possible, I may compare and contrast. One big difference between China and the United States is that the geographic concentration of COVID-19. It was highly concentrated within one city, within one province. That cannot be explained by epidemiology, right? It has to be because of the containment measures and mitigation measures that they have taken. And now if you look at the map of the United States, it's all over the place. There are some epicenters of the virus, New York, Massachusetts is one of them, California, but there are lots of regions in the United States that are also being affected and infected. If you look at the similar map of China, it's really just one region. So that says something about the effectiveness of the containment measures. The second thing I want to say is that in terms of the economic impact, you need to close the economy, maybe completely, but to the extent possible completely, but fairly dramatically, in order to reopen it, right, with confidence. That's not what we are seeing in the United States, right? The closing was never clean, it's partial, and we're opening even when the disease is still spreading, infections are still increasing. The Chinese approach is just forget about economy. Just there are political constitutional differences that allow one country to do that and another country unable to do that. So let me leave that aside, right? So their approach is forget about the economy. Just focus on the disease, focus on the COVID-19. Close down the railway, close down the airport, close down traffic, close down transport, close down everything, right? And mobility across regions cut down to zero. Mobility between individuals cut down to zero. I mean, they had the political power to do that. That goes without saying. So you kind of need to do that in order to reopen with confidence that you won't have this residual infections going on. And and this is what we find in China now. So if you look at economic data, and I wish China would do something what Professor Lautenbach advocated, which is to put more green in their stimulus program, to use this opportunity to turn the crisis into an opportunity. And that's supposed to be a Chinese term, by the way. But they're not doing that. They are kind of going back to the traditional infrastructure building and labor, capital intensive. And so if you look at the pollution data now, they're going back to the February level. If you look at traffic data now, they're going back to the February level, January level, rather than seeing this shift from capital intensive to labor intensive and service intensive production. And in fact, one of the, what I think was the most productive measures that the government announced in May, which is to open the cities to small entrepreneurs selling their things on the street, and which powered the Chinese economy actually in 1980s. And they experimented with that, and now they are controlling it now. They don't feel comfortable with that approach. That's really not very productive. But that aside, in terms of the economic recovery, there is evidence that the economy is sort of trending back, and because they put down measures to control the reinfections, to control the spread of the disease, and that's because of the other thing that they have done, which we don't see much in the United States. So what the right thing to do is that you want to use the lockdown as a period, as a time, and as a window of opportunity to build up further defensive measures, right? To develop technologies, to scale testing, to establish organizational and administrative procedures and protocols. You don't see much of that from the federal government in the United States. You know, I work at MIT. MIT is trying to do something like that. Maybe Harvard and other universities are doing at the local level. Yes, organizations are trying to develop their own procedures and their own process, but this requires a much bigger centralized approach, and you don't see much of that in the United States. So even in the best case scenario, when you actually have the virus under control, and then you reopen, you don't really have these instruments to contain the reinfection. So I'm very worried about what's going to happen in the fall. You don't have a clean control, and then you reopen, and then you don't have these measures in place. And China has that, and one of the things we have written about, published in the Harvard Business Review, together with one of my graduate students at MIT and another graduate student at Stanford, about contact tracing, QR code, that Chinese companies have developed on behalf of the Chinese government. They are really used very effectively now to check on the individual health status of the workers, of the people, students and professors and teachers going back to schools, going back to work. When you have that level of information, you feel more confident to reopen the schools, to reopen the economy, right? Testing in China is quite substantial. It's very cheap. It's available fairly easily. In Wuhan, they have scaled massively the testing. In some other provinces, it costs like a few dollars to get a test. Very easy to get a test. And the testing is not as invasive as some of the tests that I've seen in the United States. So you need to have these things in place. Then you can reopen, and China has that. The other thing I want to mention is that one difference between China and much of the Western world is that China experienced SARS in 2002 and 2003. So wearing the masks became a natural thing to do. and without second thought. Whereas in this country, there's a lot of debate, right, initially about wearing a mask, and that delayed the time. But the other thing about SARS is that I've gone back and looked at the data during the SARS period. The economy was at that time growing faster because China just joined the WTO, and Chinese economy was growing faster than it was before the COVID-19. The recovery was actually a little bit slower as compared with the current period. In the current period, so if you sort of look at these lighting data, traffic data, there's a V-shaped feature of the current recovery. But it's very important to stipulate that the initial level in January and December 2019, economic level was lower than it was in 2002, right? So Chinese economy was already trending down, and then COVID-19 happened. It further shocked the Chinese economy into a negative 6.8% drop of the GDP. I mean, that's just almost unheard of in China. Well, it's not almost, it's unheard of in China. And so it's really from that low base that you see this V shape. So I'm not projecting Chinese economy to be powering forward because of this V-shaped picture, they go back to the initial period relatively easily, and they have ways to control the reinfections. The last thing I want to say is that there's now a lot of debate about globalization, about whether or not it was a mistake to have so many factories located in China. And then when the pandemic hit, you don't have the masks, you don't have the ventilators, you don't have those things. I'm not saying I disagree with that view, but I want to put forward a different perspective, alternative perspective that doesn't get mentioned that much. And the perspective is this: globalization has actually reduced the cost of masks, has reduced the cost of ventilators. What happened in the United States was, under Trump's trade war, American hospitals reduced their masks purchase, ventilators purchase from China because of 40% tariff on these goods. So it's not globalization per se. It is actually trade war, which we typically associate with anti-globalization, that undermine the preparedness of American hospitals, at least in part, for the pandemic. So I hope going forward, we need to keep that in mind and have a more nuanced debate on the problems as well as the promise of globalization, rather than just focusing on the fact that all the masks are produced in China and now we have pandemic and we can't get access to them. Thank you.
Great, thank you very much for all of you. I'm going to start with a few questions, but as we said before the seminar, if each one of you have a question for the other panelists, definitely raise it as well. So let me follow up with a question with Yashen first. Now, your analysis of China is that China basically is having very tight lockdown, shut down the economy, and give complete priority to controlling the disease. And the certainty of controlling the disease allow them to be able to open again with more certainty that the disease will not reemerge. And so my question is, what are the indicators? Where is the point that China decide that it is clean enough, that the disease is under control? And where is the trade-off of that economy? I mean, from your perspective, if China were to open slightly earlier, would the current state of the economy be different if it had opened up earlier or differently. Hi, I think we might have lost. Are you still here? I think we might have lost Yashan. So we'll let him come back. So let me get to Carl first. Carl, you talked about the stimulus program. You talked about how Germany was able to quickly happen later in Germany compared to other countries. And so, hi, Yashan, you're back. So do you want to take the question first before I go to Carl?
Yeah, I'm terribly sorry. My Wi-Fi has
sorry. It's pouring. For those of you who are not in Cambridge, it's pouring outside, raining, yeah. And I think it is interrupting the Wi-Fi.
Okay, so I think I got the gist of your question, but could you sort of ask your question very briefly again? Winnie, can you hear me?
Yes, I can. We can hear you.
Oh, okay. Could you ask your question very briefly again? Yeah, sorry. So
my question is, your description, your analysis of China is that China has a very, very tight lockdown, in fact, shut down the economy so that it has a clean recovery in terms of reducing the cases. Then you argue that that is the strategy to allow China to be able to open. And my question is, if it happens again for China and for other countries, would you recommend that same strategy, or are there other things more nuanced? And what are the consequences? What is the cost on the economy of that very tight lockdown and almost across the board in the whole country?
Okay, thank you, Winnie. I apologize for the technical problem. Yeah, I have a Huawei phone, but I don't have Huawei's 5G. So I have rather ambivalent view on Chinese approach, right? So my view is that they should have responded more quickly than they did in the first place. They should not have suppressed the information. And they if you look at the rest of the East Asia, South Korea, Taiwan, and even Hong Kong, they learned the lesson from SARS. The right lesson from SARS was you don't suppress information. You really follow up very, very aggressively on any leads that were generated. And China didn't do that in the first few weeks of the COVID-19. And that put them in a situation where they have to escalate to such a dramatic and drastic measure, locking down the city of 10 million people, 9 million people, and locking down the entire province. I mean, not many societies can do that. Only China can do that. So even if sometimes you hear the Chinese government officials say and how superior the system is, I don't share that view at all. Because you can't replicate that. You cannot replicate that model. What you can replicate is aggressive investigations and uncovering the problem early on. So then you don't have to lock down the whole city, so that you don't have to lock down the entire province, right? So if I gave the impression that I recommended Chinese approach, then that's not the right impression. My recommendation is that you should do what South Korea has done and Taiwan has done and Hong Kong has done. You should aggressively treat the problem early on, confront the problem early on, be transparent with the public. That said, we are not in the United States. Is not in that situation now, right? And there's an argument that you can make that a more federalized approach
a more unified approach, a more guidance from the federal government is probably better than this delegated, chaotic approach and spontaneous approach that we're seeing in the United States. You don't have to go all the way to the Chinese approach, but I think United States should go some way toward a central and more federal coordinated approach. That's not what we see now.
Okay, great. I want to go to Professor Lauterbach. You talk about the economic stimulus package, but I also want to ask you a little bit more explicitly, the decision, what indicators was Germany using to decide you are ready to open the economy? And what are the measures that you put in to prevent a potential resurgence?
Well, the numbers we were using were basically a basket of numbers. We were looking at the reproduction rate, and we decided that the reproduction rate should be lower than 1 by a margin of at least 0.25. So a total reproduction rate of 0.75 was considered safe, so that you have a margin to 1, which means that the pandemic is no longer growing exponentially, but is becoming smaller. And we also decided that we would have only a couple of 100 new cases per day in combination with that reproduction rate. We also looked, let's say, at the distribution of cases and wanted to make sure that we were capable to see, let's say, super spreader events locally as quick as possible. So we made it mandatory that all municipalities, a municipality on average has 100,000 inhabitants in Germany, that all municipalities that were seeing more than 50 new cases per week would have to go back into the lockdown. So let's say, to sum this up, reproduction number target 0.75, but on a national level well below 1, then no more than a couple of 100 new cases per day, and number 3, on a municipal level, at the very most 50 new cases per week, so that we would be able to control super spreaders. There was a couple of other numbers which we looked at, like the dispersion factor and so forth, but I'm not going into that. But we made this very clear. We tried to, let's say, explain this to the public, as we did with whatever we did. So I'm, by the way, very pleased to hear what Professor Huang said so eloquently, that it is important to be quite open about what you know about the pandemic, what you try to do, and that you try to link the best available knowledge and evidence with what you are doing, so that you have a discussion. Because without the population following the, let's say, advice, without the population being part of the pandemic control, there is no way that you can control it, in my opinion, in a democracy, and that is what we did. But to answer your question, these were the 3 numbers we looked at, and we are basically explaining these numbers on a daily basis. They are reported on a daily basis to the public, and we explain what measures we will be taken if we hit the numbers locally or nationally.
Great. I have a question for Joe. What you explained about getting people safe to go back to work I think that's probably the School of Public Health is adopting that. Can you tell us a little bit how widespread is it being adopted, such kind of strategies in Massachusetts or in the United States in general? And I think what we're hearing from Judy is that a lot of times, and in fact maybe China too, a lot of these decisions is politics. And how much have you been communicated with decision maker, policy makers, with your strategy, and what might be the challenges that you have been confronting?
Yeah, it's a great question. And of course, it's really interesting to hear from the other panelists. And clearly we have a different situation happening here in the US where, to Professor Huang's point, there has been a lack of coordination by the federal government. It's been ad hoc, state by state. It's been grossly ineffective. We lost our chance between January and March to put in early controls, then at great expense to the economy. We locked it down for 3 months. Now we find ourselves in June with really no changes in terms of our ability to test, isolate, identify people, and trace and find them, and then self-quarantine and self-isolate. So we're finding ourselves in this situation. And to Professor Lauterbach's comment, we've done a poor job of communicating this openly and effectively. There's mixed messaging coming. When we roll out a control, for example, mask wearing, I've written about the public health science, why mask wearing should be done. And that was rolled out really ineffectively from our federal government. I don't think that's a surprise to anybody. Mixed messages. You can wear one or not. It's up to you. And so the public is really confused. It's become politicized, these controls. And to get to your question, a lot of this now is coming down to what organizations, companies, and individuals are doing. This is where we're finding ourselves. The reality is we haven't tamped this down. We're going to come rip-roaring into the fall with a lot of cases in the US. It's going to be very dangerous. And so it's fallen to companies. And this is where I'm advising many companies across the economy, really, multinational companies in finance, tech, major media companies, universities, healthcare systems, on control strategies they can put in place. I definitely come from the place that we can put in sensible and prudent controls to get people back to work safely and back to school safely. And I mean young kids, but also at the university. Whether or not there's the political will to do that is another question. So my domain is healthy buildings and keeping workers and people safe. I can come up with control strategies, and my team is doing that. We're releasing a report on schools this week. Whether or not the forces, these other forces, can get out of their way, or stakeholders, and implement these strategies is another question. And that goes way beyond my expertise. There is one area we have to get a handle on, and this is internationally, is recognizing that airborne transmission is happening. This is a source of frustration for me. The WHO is not recognizing it. CDC is not recognizing it. There's a focus on large droplet, which there should be, a smaller on fomite transmission, and airborne is being ignored. And it's a problem because it's tied to these super spreader events, as Professor Lauterbach said. I wrote 2 weeks ago in the Washington Post linking airborne transmission and super spreader events. I'm not sure what the reluctance is. My entire field is quite apoplectic about why there's this reluctance to acknowledge airborne transmission. We have to acknowledge it because then we can line up the appropriate controls. And we've been using this Stay Smart acronym. It's actually quite simple. Stay home when sick, mask when out, avoid large gatherings, refresh indoor air, and 10 feet is better than 6, recognizing there's no fine line here. This message is not reaching the public, and part of it is the failure to acknowledge that airborne transmission is happening. We're going to have to recognize that so we can put in these appropriate controls to stem these larger outbreaks that happen with super spreaders and in large gatherings.
Great, thank you.
Very good.
I have a question, which is, of course, the decision to open or not open would need to depend on information, on data, and unless you're in the situation in Russia of which one person make all the decision, but otherwise you have to depend on the intelligence, so as to speak, of where the virus is, how far it is spreading. In that sense, in the case of countries where tests are not widely deployed, like the US, what else would you recommend the country to be doing in addition to healthy building?
Yeah, I've been talking with a lot of these companies and setting up these phased approaches where they're starting with very stringent control measures, and then they have gating criteria, and I'll talk about that in a second, before they go to the next phase. And then another gating criteria before the next phase, and recognizing it's not linear. You might have to go back, if you're at phase 3, you might have to go back to phase 1, depending on what's happening. So you have to track, of course, these regional indicators, lagging and leading indicators. But to your point, Winnie, sometimes the data just aren't there. So what should you do within an organization? You have to be tracking your own leading and lagging indicators within the building to be sure your control measures are working. For example, you might be in an area where the transmission is quite low. The case count might be quite low. But if you have a case in your building, or 2 or 3, that's indicating that your control measures may not be working despite regional control measures working. So companies have to also look inward and start to track what we call health performance indicators, or HPIs. Everyone talks about KPIs in business, right? Key performance indicators. We need to track health performance indicators too, including real-time measurements of building performance. If you want the indicator of how your control strategies are working, you can monitor this in real time. So you know if something happens or changes in your building, which would change the risk profile of people in that building. So you can respond quickly. So it's not a helpless position. You know, I do wish, and I hold out hope that we will turn things around in the US. But outside of the federal response, some state responses have been quite good. And also, I'm impressed with what the companies are doing. They're innovating fast. They are putting in more stringent controls than are required by WHO and CDC. And they're putting in these gating criteria and diagnostics to measure the performance of their controls so that they can catch things quickly, even if we're not catching them in the US at a regional level.
So Joe, can you just quickly comment on how costly it is to implement these kind of strategies?
Yeah, I'm glad you asked that, because it's a real misnomer that these are expensive. There's this idea out there that healthy building strategies are really expensive or are only for the shiny new buildings. And like I said, I've done hundreds of these sick building investigations and have turned any sick building into a healthy building with just a little bit of attention. I've been really careful in my recommendations to make recommendations that nearly every building and business can implement. I'm not recommending some fancy new technology. I'm not recommending every building has upper room ultraviolet germicidal irradiation, right? Simple controls. Run your fans a little bit higher, bring in more outdoor air. Open your windows in a naturally ventilated building or your home. Recirculate air through higher efficiency filters. Supplement that with these portable air purifiers and air cleaning technologies. This is not expensive. And the other thing that's not expensive are administrative controls. Choreographing people and flows of people in buildings is not expensive. Extending the workday and giving people flexibility on their commute is not expensive. So, you know, we can be smart about this, and it doesn't have to cost much at all to implement these healthy building strategies to keep people safe and kickstart the economy.
Great, thank you very much. I'm taking some questions from the audience, but before I do that, I wonder if the panelists yourself, do you have a question for the other panelists before I start taking questions from the audience? Judy?
Yeah, I do, Winnie. May I ask a question about China? And that's about the extraordinary capacity that China has shown to ramp up testing quickly in specific areas where increased numbers of cases have started to crop up. And if there are any lessons that the rest of the world can learn about China's capacity to mobilize that enormous scale of testing that quickly. And then a question for Joe. Everything you say makes so much sense, and you've just outlined how it can be relatively inexpensive. Why isn't there better uptake of this? Why does there seem to be so much reluctance to move forward with these investments?
Thank you, Judy, for the question. I think unlike Russia, China, I think there are two aspects that differentiate between China and Russia. One is that Russia, we may say, is a illiberal democracy. It is a problematic democracy. It is still kind of a democracy, and so you have elections, and the very fact that President Putin felt that he needs to have a popular election to decide on this constitutional issue. China didn't bother with that. They just got rid of the constitutional restriction on 2 terms and then move on to permanent term. So so that's one difference. But that's not the essential difference. The essential difference is that Chinese state is in both in the good and in bad ways, administratively capable and powerful. And this is not necessarily because of communism. I'm writing a book on Chinese history, and this strength of the state goes way back to the early period of the Chinese Empire, and the ability of the central state to systematically scrutinize local officials. Joe mentioned health performance indicators. At business school, we teach about KPIs. The Chinese were doing that 2,000 years ago, and they had an exam system. So that administrative capacity is very, very deep. The data collection capability is substantial, and that went back to the Han Dynasty, not just with the AI and computer technology. So they know exactly what is going on. Mobility tracking. Now with the technology, they have an extra level of capability. The third thing is that if you think about the United States, there's a Wartime Power Act that enabled the president to take over the production, right? And President Trump refused to invoke that, even though I think he's a dictator, he's an autocrat. For some reason, he doesn't want to make himself powerful, something I don't quite understand. And he's not a consistent autocrat. Whereas in China, that power has always been available. So they can mobilize, they can nationalize the capacity very, very easily. Very often that has turned out to be very bad for the economy, for the society, in terms of repression, in terms of human rights. In this particular case, they have used it to escalate testing, escalate mitigation, escalate containment. And so it goes back to that power on the part of the state to know what is going on in the society, to mobilize the resources very, very quickly, to nationalize the economy very, very quickly for a particular purpose.
Joe,
Yeah.
yeah.
Nice. Thanks for nice comment. And Professor Twigg, thanks for the question. And the reason why there hasn't been uptick is what you hit on in your opening remarks. It's a real failure to educate and communicate here. It's come down to, a handful of public health scientists that are working sometimes one-on-one with companies. And enough, some of these messages haven't grabbed at a high enough level, and the messaging has been faulty. We've sidelined the CDC, which I don't quite get. We all saw in the US in April, the CDC they wrote detailed back to work plans that were actually quite good. That was leaked out. It wasn't released. What was released was in the end of May was a watered down, simplified, a document I could have written in 5 minutes that says these higher, some higher order things we need to take care of. So that has been a problem. And there's lots of organizations in different sectors craving that information. And God, just tell us what to do. We'll do it. We'll do anything to get back. That said, there are companies that once they hear the message, even my message, say, oh, I didn't realize I had to do that. I'll take care of it. I wasn't realizing I had to take care of my HVAC air conditioning system. I'll do that. No problem. I'll take care of bathrooms. I'll put in these administrative controls. I'll deal with people in elevators. No problem. So it's not that they're afraid to act or they can't act or that it's expensive. It's just that they don't know it because it's been a failure to communicate it effectively.
So Judy, there is a question from the audience. The question is, are you surprised that the Russian Ministry of Health is not able to manage a comprehensive national response? Or is it that the MOH ineffectiveness is a reflection of a weak and hierarchical system?
I would not disagree with the comment that this is a weak and hierarchical system. All the conversation here is pointed toward the importance of accurate, well-disseminated, well-communicated information as key to an effective public health response. And in Russia, I think they've suffered the consequences of what we've come to call Putin's vertical system of power, where he issues orders from the top down, and he's put increasingly in the last few years, technocrats in place at the regional level who are expected just to carry out those orders. They don't have much capacity, or it's very uneven. Most of them don't have the capacity for sort of bottom-up analysis of the situation on the ground and generation of locally effective solutions. Within that system, there's also a reliance that we've seen, amped up to a higher order of magnitude during this crisis, of habits of telling the guy who's the next rung up on the ladder what you think they want to hear. So the information that's sent up from local health departments, from health facilities up to the higher levels of administration is carefully calibrated to tell the boss good news rather than suffer the potential political or administrative consequences of being the bearer of bad news. And so the bad information that we've had that's really characterized much of Russia's response to this pandemic hasn't necessarily been the result of some sort of secretive, top-down, insidious attempt to manipulate the numbers, or there aren't two sets of books, one the real secret numbers and the other the data that's being presented to the outside world. Instead, it's a situation where even when the people at the top now might like to hear the accurate numbers so that they can affect an accurate science-based response, it's hard to get the people on the lower rungs of the ladder into habits of truth-telling in a system that looks like this one.
So Judy, now that, as you say, the situation is still not under control in Russia, not only that, people are actually being sent out and there are a lot of activities that are being organized for the voting. And many of these activities are precisely things that in the US are actually put at the last stage to be done, that is huge group gathering. Do you anticipate that there will be a huge increase, and how would that then, is there any accountability system that, if that happens?
I think there are many in the political opposition who are hoping that the electoral process in the long term will serve as an accountability system. So it will be very interesting to look at what happens with turnout for this upcoming referendum and with other election processes moving forward. In public health terms, what I expect to see is a proliferation of localized outbreaks of the pandemic. We were all, us Russia watchers were all, I think, pleased to see that the system of medical care in Moscow rose to the occasion. There was plenty of surge capacity there. Obviously, there were issues, but Moscow's hospital capacity and its human resources and technical capacity to handle a tremendous burden in Moscow, a New York, Seattle level burden for some weeks in Moscow, they were able to deal with that. The quality and capacity of the healthcare system outside Moscow is a much bigger question mark. There are issues with simple numbers of hospital beds, numbers of health personnel, and even more dire questions about the quality of the care that can be delivered in many of these places outside Moscow. So we still have fundamental worries about health sector capacity as the easing of restrictions leads to outbreaks around the country.
There's a question which is a good follow-on to this, again to Judy also, is what is your sense of the public opinion about the government's response, especially given the divide between the local and the federal response?
Mm-hmm. So Putin's numbers across the board are sinking. They're lower than they've been in quite some years. And to my mind, the real crack in Putin's armor actually started a couple of years ago. It started in the summer of 2018 when he raised the pension age. And that caused quite a bit of public outcry, he had to walk back some fundamental pension reform that had been proposed back in the summer of 2018. And again, Putin tried to play a blame game back then, tried to shift responsibility for that pension reform onto others, but it didn't quite work. The blame for that stuck. And now increasingly people are seeing Putin's, as I said earlier, his response to this whole pandemic crisis situation as having been less than forceful, less than effective. And really a key benchmark here is the popularity ratings for many of the regional officials. Many of them have stepped into the spotlight, have taken the reins, have been much more charismatic in their response. And so we may be seeing a fundamental shift of the political spectrum away from a centralized Moscow-based control system out to some of these regional leaders who have been perceived as more effective.
Great. I have a question for Carl. Just a second. Sorry about that. So Carl, there's a question that someone would like you to talk a bit more about the pros and cons of the non-central German approach in light of what Professor Huang was talking about China and the US. The question is, how do you think that the federal and regional policy were being coordinated in Germany?
Do I understand the question? Talk about state responses? Is that, pardon me? So you want me to talk about, let's say, central versus state-driven responses in Germany?
Right.
Is that right?
In Germany, how are they being coordinated? That's the question.
How is that? Well, the way we coordinated it is that the state governors for important decisions would come to Berlin and meet there with Chancellor Merkel and let's say most important ministers and members of parliament. So we had basically group meetings, which were typically day-long meetings with Merkel, with the state governors, and with, let's say, the most important ministers for the respective fields. Once the decisions were made, then Merkel, with a couple of state ministers and also a couple of, let's say, state governors, would address the media in a nationally broadcasted TV approach and would present the results from, let's say, the federal perspective, and the states would then basically comment on that. And there was, let's say, some small discrepancy how the states would implement this, but it was by and large a federal openly discussed and openly, let's say, evaluated approach. Later, when, let's say, the pandemic was more in control, then the states received more freedom. They received more possibilities to basically go their own way, in particular because there was, let's say, very big differences in terms of the number of new cases from state to state. But from a federal perspective, we ultimately made it mandatory that then was, let's say, a re-initiation of the lockdown on a local level if in a municipality there would be more than 50 new cases per week. So that was basically the that was the limit of their freedoms. They would have to go into a local lockdown again if there was more than 50 new cases per week. That's the way we basically approach it. And this is where we currently stand. We are preparing for a resurgence. So we are now opening the schools step by step, but we assume that since, and I was so pleased, by the way, by Joe to point out the importance of aerosols. As an epidemiologist, I could not agree with you more. Our assessment here in Germany is that 50% of the transmission is by aerosols, 40 to 45% by droplets, and then 5% by other forms of contamination. So aerosols are the driving force of the pandemic. and in particular for all super spreader events, let's say aerosol contamination and aerosol transmission is the most important. So we took this into consideration. That is why we very much invested in, let's say, mask wearing, and we made sure that for all indoor events, let's say air conditioning has to be controlled, and also, let's say, fresh air has to come in on a very regular basis, because we know that, let's say, in indoor situations, with a super spreader on the side with the aerosol transmission, that is the highest risk. That having said, this is what we are looking at in the fall, because currently, because of the summertime here in Germany and in all of Europe, many people are outside, and we have a better time of controlling the pandemic outside than inside or indoors. But if we are back to indoors in the fall, we have to, let's say, be aware that, let's say, resurgence may take place, and we will have mass testing. At that time, we will, at any given point, be able to do 1 million tests a week, and are in a position to, let's say, multiply this by 8 if it is necessary. So let's say if for example, for, let's say, school controls, parents control, children control, and also control in the workplace, it is necessary, we would ultimately be in a position to do about 8 million tests per week. And we would even be able to do more if we go forward with pooling techniques. We are also, let's say, looking into pooling techniques that were developed at Harvard and MIT, so-called combinatorial pooling techniques, in which I'm particularly interested. But this is beyond what we are discussing here. But nevertheless, we have, let's say, a state-driven system at the moment. But if there is a resurgence, we will have a more centralized response again. We had an initial centralized response at the federal level, with the states being involved and the scientists being involved at any given time. Then we allowed it to diffuse into the municipalities and on the, let's say, state level. And we will come back towards a more federal and a more, let's say, centralized response if we were having a resurgence in the fall.
Great. So a very nuanced strategy, that central-local relationship depends on the severity of the situation, and also a more nuanced approach of when the situation has improved, you adopt measures that you would also try to minimize the resurgence impact, if not eliminate completely. Before we close, why don't I ask a last question to all the panelists, which is a summary of a few of the questions submitted by short of having a vaccine, if you were going to recommend the country that you speak about, if you could, short of taking away politics or incorporating politics, what would be the top priorities that you would recommend to either reduce the current damage in terms of health and economy, but also be more nuanced in preparing a resurgence? So if you have said that already, still you can repeat that, but just sort of a concluding remark, concluding recommendation for the audience.
I'm happy to go first and talk about the U.S. context. I've said it before. It's really clear to me what has to happen. All the things I've been talking about are what businesses, organizations can do. And like I've said, I'm pretty impressed with their response. I'm also impressed, at least in some pockets, with the personal behavior change that's going to be necessary here in terms of hand washing, mask wearing, maintaining physical distancing, everyone doing their job in here. Unfortunately, some of that's become politicized. That's a real problem. But what really needs to happen is testing and contact tracing. The contact tracing part is just not happening. Our testing has improved somewhat, but it's certainly not at the place where it's widespread testing. And if it's not paired with tracing and isolation and quarantine and messaging, to Professor Twig's point, it's going to fail. And it's going to fail in a big way, and it already has. 100,000 deaths in the US, that's not acceptable. It shouldn't be acceptable. We're on a path to 200,000 by September. That's not acceptable. That will still be the early phase of the pandemic here. We'll go way past that too. My concern is that we're not using our time wisely. We haven't so far. Even if we get a break this summer, which maybe we'll get a little break, although the recent uptick in cases in some states suggests that's not the case, we will be going into the fall not at midway point of an exponential rise due to seasonal forcing. We will be going in high, right? We won't be starting low, which means we'll likely see these effects earlier on in the fall than people think. And the only way through that really is to get up these national plans in place. There's only so much individuals can do. There's only so much individual organizations can do. It's going to require a stronger federal response. I don't have a lot of hope there.
I'll go next.
National response, contact tracing, tests, things that Germany are all doing quite well, China doing quite well, not Russia yet. Judy, go ahead.
So if I had one recommendation, it would be to engage civil society more intensely and broadly in the response. One of the remarkable things about this situation has been the way in which, at least in this one little corner of the crisis has been turned into something of an opportunity, to borrow things that have been said earlier. Even in the middle of an economic turndown, donations to charity and civil society and social organizations are up significantly in Russia. It's been remarkable to watch individuals, to watch non-governmental organizations, civil society groups step into the cracks that have been formed where the government has not been willing or able to respond. And that kind of energy is not new for Russia, but the scope of it has increased quite a bit during this crisis. So the extent to which the government can continue to take advantage of that resource, continue to take advantage in terms of generation and dissemination of good data, and also social services, particularly to the many marginalized groups around the country, that certainly will affect the quality of the potential response from a public health perspective, and also enable, I think, better mobilization of the economy, a reopening moving forward.
So let me also comment. I think we as academics need to, after the pandemic is over, we really need to think about some profound issues about how we have responded to this outbreak. And let me just describe a number of them without saying what the conclusion is necessarily is. One is the nature of the political system. And many people are saying that, oh, democracy is losing its battle. Chinese officials are saying that that's just not true. I mean, United States has done a terrible job, but I don't think it is because the fact that it is a democracy. Germany has done a good job. It is a democracy. South Korea has done a good job. It is a democracy. Taiwan has done a good job. It is a democracy. In the United States, we have a incompetent leader, and we don't need to say more. That I think the reason why democracy has not failed in the United States is in part because what Joe has said. There are many, many good responses by companies, by universities, by organizations. You need to scale those things. And the failure of the leadership is that they didn't scale these things. The other is that the way we judge a system is to say whether or not the system is effective in producing information. Chinese system failed in the earlier period. They suppressed the information rather than producing information. United States had all the information. And for the United States to blame its blunder on China, it's just absolutely a lie, because South Korea acted on the same information from China, Germany acted on the same information from China, Israel acted on the same information from China. The failure is the leadership, it's not the system. The other thing I want to say is that the societies that have responded effectively to the coronavirus are societies that have trust in certain institutions, trust in government, trust in NGOs, a civil society point made by Judy, which is a very, very good one. My worry about this country is that this current administration is undermining the trust. The CDC, which is one of the best institutions in the world, has been undermined by this administration. The use of the military to score a political point. So if you look at the polling data, which institution enjoys the highest trust among Americans? It is the military. And Trump is undermining the trust in the military, right? I worry about that. Thank you.
How would you put us on a more positive note before we completely conclude?
Well, thank you so much. First of all, thank you so much. First of all, I agree very much with what Professor Wang was saying, that let's say democracy has been able in many countries, not only in Germany, to live up to that challenge. And this is, in my opinion, clearly is a good news. And I'm also fairly convinced that we learned a lot about the pandemic and about politics at the same time. And we learned possibly more about politics from the pandemic than the other way around. That, for me, is a very important point, because what at least in Germany, but not only in Germany, and many other European countries, we have seen is that politics can work very well if we take science and scientists more seriously and communicate evidence-based policymaking to the public. We should not underestimate the intelligence, the common intelligence of the public when it comes to communicating scientific facts and necessities. I have learned that the public is not often able to express these numbers and equations, but the public understands what is meant very well and can be taken along on that path. And I think that, let's say, this is what I have learned from the pandemic so far. This, in my opinion, is the only way that we will ever be able to mount, to live up to a much bigger challenge, which is ahead of us, ahead of all of us, which is the climate challenge. The climate control can only be managed, can only work in the coming crucial decades if we work in a transparent way, then in the very same way we have done in many countries, not only in Germany, but Professor Wang correctly pointed out also in many Asian democracies, is the very same way we did it this time. We have managed it this time, that let's say we stand shoulder to shoulder on equal footing, politicians, scientists, and policymakers, and that we, let's say, try to engender the trust in our institutions and depoliticize important life-saving measures that we have to take at a national and at a community level.
Great, thank you very much. I think that we haven't come through this pandemic yet. We're still in the midst of it. We might, for some countries, we might have survived the first wave, but we don't know whether there is a second wave. And I hope that the platform that we are setting up today provide an opportunity for different scholars and countries to learn from each other, so we do not repeat mistakes that other countries has made, and help us get through this pandemic in a more rational and informed way, so that we can learn to prepare better for the future. So thank you very much. And I appreciate your time. I know everybody is very busy, and all the lessons that we're drawing from you. Thank you. Bye-bye.